Hey, it's Dr. Pierce, Michigan Sports and Spine. We're looking at show 20-something, 27. So like I said last week, when we get to 30, I'm going to stop counting because we're here to stay, or at least we're going to be here for a longer period of time. Anyhow, this is a big day. Besides being the crazy, beautiful weather we've had, 11/11 of 2020 is Veterans Day, which for me, I don't know, for those who have known me for a while, I was fortunate to be the ambassador for the special 200-year anniversary of the 1812 Navy event that was downtown. It was multiple things going on. It was where the tall ships came in and we were able to do it. So I was never called sir so much in my life. So it was a great thing that we did. I got to meet a bunch of admirals. Got to learn a lot about our government, about the people that are fighting for our freedom, which we take for granted. And I may be one of those too. But to be honest, since 2012, I go out of my way to be thankful. I hope I'm thankful. But overall, especially with what's going on right now, I think there should be a special shout out for all veterans and current military that really allow us to live, I don't want to say a privileged life, but a very sometimes sheltered life. And what's been going on with our election and our government today, which I don't want to get too political, but if we can't say thank you for our freedom and what we have here and what's special here, then I think we really need to do a reset button, because a lot of people do sacrifice their lives. It's just like a movie I was watching yesterday. It's like we have government people that just like pass it by. We're just going to switch channels. You don't realize where people have sacrificed in the military, being away from their wives, their families, or wives being away from husbands nowadays, where they sacrifice multiple things for the safety of this country. And hats off to you. And especially for military, we do a military special where we'll allow any military person to come in here. I know the VAs try to do the best they can. Sometimes fortunate enough they don't have the specialists like we are, and I've never been able to turn down a military person. And also with my charity called Athletes Unlimited, we have a lot of disabled athletes, which were also disabled veterans. So I've been in this field for 25 years and appreciating them. And because of Athletes Unlimited, we've dealt with people that have lost limbs, spinal cord injuries, and things like that. People that got blown up in Hummers that we've turned into athletes and positive, and just unbelievable individuals, people that have gone out of their way for the safety of our country. So let's not take that for granted. Let's definitely take a moment to appreciate that. So enough of that political stuff. I didn't get into the that other thing of who our president is. So congratulations to those. So question 1. I've struggled with back pain for years. Last week you talked about primary pain generators. Please go into a little more detail about what that really means. So what it is, I'm going to get my fun spine here, but the primary generators, like people say, I have, like the last patient I just had, he went to a certain type of orthopedic doctor that specializes in knees. And sometimes we look at, because of our specialty, and I'm probably guilty of it too, we look at what we know best. And they were looking at the knee to be the cause of his discomfort, but when it got teased out 4.5 months later, they found out it was really his back. So when we say primary and secondary pain generators, the primary for me is always determining what the major cause of most of the issues are. And for the biggest part, that comes from the root of the problem, meaning your spine. So this is your spine again. This is the front, this is the back. Here, this is the bone, this is the disc, these are the nerves. These nerves are the ones that get pinched that can cause the secondary issues. So the first thing we look at is the anatomy of the spine. We're looking at the disc being pinched on the nerve, and there's multiple ways for this nerve to be pinched. It's not just by a herniated disc. It's by shifting of the bones. It's by this opening being closed. It's by a decrease in the height, which will compromise these nerves, and also centrally in the nerve itself, in the main spinal cord. So what you want to do is be able to find out exactly what that is. So again, when I talk about primary problems, we talk about from the spine. When we talk about secondary issues, people are like, oh, I have sciatica, or I have an SI joint issue, or my hip hurts. Those are all secondary things, meaning you need to make sure that the root of the problem, which is 90% of the time coming from the spine itself, is not the original problem. Because if you just treat the hip or the knee or the SI joint where you're not resolving what's going on at the back, 9 times out of 10 you're gonna not address the real problem, and you get a short-term relief, but you don't get a long-term problem. So that's why it's so important to make sure you get what the true diagnosis is. And the true diagnosis is that you need to go to somebody with the right tools. Again, someone like myself that's very comfortable. We're non-surgical, we're not narcotic. We need to find out what the true diagnosis is. So to go into a little more detail on what that means, there's classic secondary issues that stem from the primary problem, which comes from either your neck or your back or someone in the spine. Because the spine, again, is the root of a lot of the issues that may be happening down the leg, more of what we call peripheral. So if you're having this weird sensation in your shin or weird sensation in your foot, that probably 9 times out of 10 could be coming from your back. So you need that evaluated. Like we have foot doctors that refer us cases because they're complaining of foot pain. Well, there's nothing there anatomically in the foot. It's coming up as a referred pain from the back. So those are major issues that when that's happening, if you go to the wrong physician to begin with, you could be sitting at 2, 3, 4 months until you're really to the person who can actually start treating you. So again, I mean, and another reason, that's why I'm doing this. That's why I'm doing this Facebook stuff. It's not because I love, Nicole loves to do it, but it's to educate the people. It really came from my radio show that starting to learn, like even my friends don't understand who the first line of treatment would be for certain issues. Granted, I'm not taking over diabetes, I'm not taking over hypertension, all the medical things. I'm staying in my zone of musculoskeletal medicine, non-surgical, non-narcotic, where we take on probably 90% of the issues. And that's, for me, we have fallen specialty into sports and spine injuries. So we're very, very comfortable. Going, like I have new doctors here. They have a learning curve where, I have 20 years of experience. It's going to be hard to get me to see something I haven't seen. Does it still happen? Probably once or twice a month it still happens. So what we want to do is make sure you get to the right person with the right tools to make the right diagnosis to get you on the recovery phase as quickly as possible. So, question 2. What's the ideal age for someone to get PRP in their shoulder? So, ideal age. We always say earlier the better because one, when we talk about PRP and stem cell, it's always the earlier age because one, you're healthier. It's like the collagen in your face. When you're 20 years old, your face looked a certain way. It's because your collagen was healthier, it was stronger, it was more vibrant. Same thing with your PRP and stem cells. That's the basis behind some of this all the time. So ideally, they say between 20 and 25 is ideal. But to be honest, probably 35 is the most common where we start seeing it. We'll do it all the way up until the age of 90 if you're biologically younger than your true age. So PRP is a little bit different than stem cell. PRP is, again, what we take from the blood. We draw your blood, we take the healing properties out of it to create that healing cascade, re-inject into the injured area. In this case, they're asking about the shoulder at an 8 to 12 times concentration. So you're increasing that cascade of healing and you're allowing it to call out, signal the rest of the body's healing properties that come to that area too. So there is not an ideal age, okay? Ideal age is always yesterday. That's the whole motto the company work with Forever Labs. When do you store your stem cells? Well, you do it tomorrow. If you didn't do it tomorrow, then today's your better day. Every day it's better to do it yesterday, so it's not something you wait on. If you truly want to do the scientific part of it, you want to get these things done at an earlier age. So your ideal age for it, again, is about 20 to 25, but there's not that much of a decline into your mid-30s to 40s. If you're healthy and you stay healthy, that can spread all the way out to your 80s. But if you're, damaged, like we've talked about, the best healing mechanism of of you for any injuries is a good infrastructure of your body. So you have to treat it well. You have to, the smoking, the drinking, the marijuana, all that stuff's going to play a role on deteriorating the body's abilities to heal on its own. So you need to examine what you're doing on a daily basis. If you're working out, if you're healthy, if you're eating right, all that stuff's playing a role for long term. I mean, no matter how many papers you want to write, how many different diets you want, it always comes back to the same thing. Healthier living is going to produce a healthier outcome. Your body is your number one issue with that. So hopefully that will answer, but the real question is you need to become an evaluator. Everyone's capable of doing a PRP injection. And then we'll talk about the pros and cons related to your age. So question 3, hello, I'm an internal medicine physician. Saw your show on Facebook. Do you have a set of treatment programs for certain conditions, or do you create them once the patient has been seen? So it's kind of the answer is both. Ideally, we've been around so long, when you have an L5 herniated disc, we kind of treat it the same way. Our other factors come in was what comorbidities you have, what kind of issues you have, what your interests are. Like today I had a 21-year-old female that her life is to do rock climbing and to be a competitive rock climber. We need to be more aggressive in what we do in those kind of cases. But overall, I would say probably 75% is similar, and then we customize that last 25 if it's in that common zone. But then I can have patients that, it's just my hip and I can't identify what's going on. We have to tease out what's going on. So ideally, the answer is everybody's customized. There's no set protocol that, okay, the MRI says there's a herniated disc at L5, therefore you're set into this protocol, and therefore you will heal in 6 to 8 weeks. It's not that simple. We need to be very active. We don't like, okay, you're here today, we'll see you in 4 to 6 weeks. You're here in 1 to 2 weeks. Ideally, 2 weeks is the time frame. We'll set things in motion, and within 2 weeks, if we're not seeing results, we're not waiting another 4 weeks of, wasting 2 weeks of your life saying that, oh, okay, let's try this now. It's very dynamic. We're moving very dynamically and customizing. So we're always adjusting. Sometimes it's easier when you start falling within those parameters of healing than we're expecting. But by bigger issues, we're probably accurate, I want to say 60 to 70% of the time. That other 30 we need to tweak, or we need to up it, or we need to motivate you that, okay, you're feeling better. This doesn't mean you just blow off your home exercises or forget about it. We're your cheerleader with good education and direction. So yes, for the most part, we have set programs that we go to, but they're all customized. Like I may have weight issues. I may have a guy, like a guy I saw today. He's very thin, very fit. He does workouts 5 days a week. He's going to be a much more difficult patient to deal with because he's already got the flexibility. He's already got the stretching in place. He's got core strength. So these are the people I worry about more, that they're harder to treat because they're already doing, say my first 8 out of 10 things that we try to improve on. But we need to tweak those 9 to 10 things. And sometimes when this happens, we look for what we call a zebra. That's something that's outlying, that's not in the box of our treatment. So we got to be smart enough to recognize what's inside, and then be alternative to recognize that this isn't going as directly as we thought. That we need to think more peripherally or look for other things. And I'm not talking about cancers and things like that. It's just ligamentous issues. Especially with a high-end athlete, they're very in tune to their body, and when something's just out of whack, you're going to have, things just feel off. Your pelvis feels off. If you're running a lot, it just doesn't feel right. You're out of sync. So those are harder people to deal with. But that's what we love to do. We love that challenge. I had a patient last week. I'm like, you're my new challenge this week. I go, thank you. It wasn't a compliment, by the way. So question 4. Does it matter where I go for MRI? Are some places different than others? I had one done prior to COVID that I was told was a bad read. Not sure what this means. Can you explain? Well, I'm not sure if you're one of my patients because I'll say that it's a bad read. Yes, MRIs are, especially in our field, the musculoskeletal field, the spine, there's definitely a difference. I don't want to throw anybody under the bus right now, but there's certain places I will not utilize because they just peripherally read it. Anyone who says degenerative disease on a young individual, I will make a phone call and say you won't be reading my cases anymore, because that's not what they're in my office for. Like I teach my fellows and my medical students and my residents, these people are not here for their own good. It's not like they don't have anything else to do. They're here because they're truly hurting. And the bottom line is that we need to figure it out. If we don't figure it out, there's certain doctors that turn it back onto the patient. Well, you're just crazy, or there's no way that could be. Or is it that we're just not figuring it out and using the right tools to figure it out? So I depend a lot on my therapist. I depend a lot on my imaging. So when that imaging is a generic read or like a peripheral read, that hurts. That hurts what we're trying to do, because then I gotta go read it. I gotta go break it down. And sometimes some of these places that are doing, imaging for certain prices, you need to ask how many times they're slicing it, because it comes down to multiple slices, meaning when they do an MRI, they do slices, and the smaller the slices, the more amount of slices, the more pathology, more issues you're going to get. So if it's one of those quick MRIs that I paid $250 for, sometimes you're not getting the same quality. So you need to ask the extra question. A lot of times when you come here, we use certain places because they know how I want it read. You can't just blow through it, just like our therapy places. I have protocols, I have expectations. I'm not the guy that just gets cookbook reads and cookbook therapy, because my success is based on a lot of that information and us doing well. So yes, absolutely. During COVID, we can give everybody the slack because we didn't want you there long. Everything was short and everything was different. So if you feel you got a bad MRI, I would call the facility, see if they're willing to repeat it, and ask them if they did do, because to get you in and out, the slices mean that you need to be in there longer. So if you were there a short period of time, that might have been the issue, and you could get more pathology or more the issues resolved if you just call them and ask them that, is this what happened? So again, I don't want to throw anybody under the bus. So question 5, how are you and your staff staying safe, healthy during the pandemic? So we have someone here, our therapist, who is and we tend to make fun of her, but we totally appreciate her because she is keeping everybody on their toes as far as the pandemic, which we would be anyhow, but she's taken the lead. And even Nicole here, everything's being wiped out, everything's being sanitized. We're watching who's coming in and out. We're taking temperatures. We're making sure who's coming in. I'm not bringing everybody in. We're still doing the telemedicine. I know some offices are bringing everybody. We're not comfortable doing that. We have patients that have had COVID. They're comfortable in telemed. They're not feeling well. They've had family members. Because if we endanger our office and we endanger the patients and what we can actually do. So I feel we've taken a great precaution. We might have been criticized that we're not opening it up enough, but with the numbers going up right now, I think our caution has paid off. We haven't had an issue. As far as what we're doing personally, everyone in this office exercises on a regular basis. Now, most of us do, especially me. Everybody, I push it that I don't feel right if I didn't do some type of activity to stay healthy. And I've pushed this multiple times. It's prevention. It's sleep-wake cycles. It's proper eating techniques. It's building up your immune system, building up your exercise. You being stronger, building up your, that's what's going to be safer. Are physicians more immune to it? We thought so, but you've heard terrible stories that physicians have caught it, and a friend of mine has passed away. So we're not immune to it. We may show an arrogance that we are, but deep down we know our safety is the most important. Because otherwise, if we're down, then my staff's down, then our office is down, then our patients are down. So it's a trickle effect we don't want to ever see. Through the numbers and the percentages, we're all going to catch it, possibly. But if we can be a little bit stronger and smarter, then that's what we want to do. So we have followed CDC guidelines throughout. Everybody's wearing a mask. We encourage everybody. I've never washed my hands so much. I've used more hand cream in the last 6 months than I think I have in the last 6 years, because my hands are getting so dry from being washed. So we've done all that. We encourage you to, feel safe coming to us. Allowing you to tell your family members that you're safe to come. Make sure you're safe to come here. We appreciate that the patients that have had a little bit of question, that they've stayed home and they've, respected what we're doing here. So we appreciate, I think it's just a team effort. And that team effort is really our big message. So overall, I know we got Aaron on last week. We're going to have more guests coming on. We're hoping, hopefully, to have our nutritionist on next week if we should fit it in her schedule. The other thing is, applicator. You're going to be seeing some pictures of myself and Abby. One is big Michigan State guys who are huge. There'll be a photo of us on the sidelines at the Michigan State game with Darren and I. We'd love to share that photo. Abby's a great guy. It's the guy lived his heart. He's just can't say enough things about him. I've been very fortunate to be friends with these guys, and he's a class act. He's always been, his door's always open. You ever ask him anything, it's always trying to help. He tries to live a private life, but overall, he's a phenomenal guy. Never shies down from anything we've asked of him for our charities or for anything else personally. So he's been a phenomenal guy. We'll miss him, but the game's the game. I think everybody understands that, including him. I think he appreciated his time here and his story about when he got drafted. I got to meet him right then. He was the young pup with all the big boys that I was already friends with. So it's like, who's this kid? The reason I gave him a little respect is because of the Michigan State thing. But that's between you and I. All right. So to summarize, we've had a great time. We encourage you. We had a great following last week. We did the Instagram and the Facebook Live. We really want to push it. One is, not just to see my face everywhere. It's to answer those questions where it can put you, instead of 3 months behind in a medical condition, it puts you in the right place at the right time. That is my biggest message, and the biggest reason I do this is to educate, so you ideally build confidence in what we do, but also if you're not in our area, if you're watching in another state, another county, find the right physician for you. Don't take all physicians for their word. It has to make sense to you. That's why I end almost every patient conversation with, do you have any other questions for me? I end that, and my fellows and my residents have all picked up on that. And it's just a nice way to keep that door open. I'm not here rushing you out the door. I'm not moving out, I'm not walking out the door. I want to make sure you understand. And the biggest thing I learned a long time ago is that make sure you think you said something correctly. It's who's you're talking to is the way they interpret it to make sure that you said things correctly. So that's the big message. So in our summary, proper protocols, we individualize the treatment. Some of it's going to overlap because it's spine. It's obviously going to overlap. We've had success in certain things, which we continue to go to through our protocols, and we totally are looking to get to optimal function. I love the word optimal now. Optimal realization of what's going on, optimal function, optimal recovery is what we're really pushing. So about prevention, understand your injury. What we try to do is resolve your injury and prevent it from happening again. Like my poor 21-year-old, I had to tell her she's got a spine that's older than her, similar to what I had. I could relate to it totally because at 15 I got undercut, which started my cascade of a bad back, which I still suffer with now. But I told her, I'm going to make you better because I've already lived it, and if you follow my instructions, you're going to be just fine. Because she kind of got bummed out when I explained to her what's going on to a 20-year-old. Mom got on there, and it got emotional for a minute. But we're able to handle it, and she will be better off. And I think this is the right place for her, especially because I'm sympathetic to that, and I work harder to get those people better. So being proactive, not reactive. Again, be anticipating, be respectful to your body, I'm not picking on people who smoke, but I am picking on you. I'm picking on people that are not in good shape. Everybody can do something. I understand, like with myself, I've been hurt I'm going on my 4th week. I'm still out there trying to ride my bike. I've altered my life. But right now it's the best day I've felt in 4 weeks because I feel, between my therapist, Faith, some of the ideas she has, some of the things, the way my kids make fun of me is also motivating to get better because they call me the old guy. I can't tolerate that. So we can sympathize. I can sympathize, especially with spine and multiple injuries that I've had, to understand your needs and what's expected. The last thing is I just want to see you guys being proactive. You know, if this COVID thing has done anything for a positive, it's for us to be more preventative and more understanding, and hopefully on the other side we're going to be smarter for it. So, being that it's Veterans Day, basically from a military standpoint, we think of may we think of our freedom not as a right to do as we please, but as an opportunity to do what is right. So, you know, that's to pass it on. For people that are struggling, or people that are struggling through COVID, you know, pass it on. You know, for if you really step back and realize what we have, and I usually do it with our disabled athletes, but appreciate what you have. You know, I'm guilty of it. I'm always looking ahead, but I do appreciate what I have and who I have. And peace out and enjoy the rest of the day.